So I had this personal experience of pain, which really, I think, changed how I saw, patients. That's a situation that so many of us find ourselves in. Think about how many people write, how many physicians write after they've fallen sick. That personal experience, I think, helps them cross over into what it's like to be a patient in a way that the absence doesn't.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This episode is a neat one for me because the guest on today's show, him and I go back quite some years. So I have with me Haider, who I've known for many years, as starting back to his residency days at the BI Deaconess, and this was before he ventured to Duke for his cardiology fellowship, only to return back to Boston as a cardiologist at the Brigham and Women's Hospital. And his trajectory has been phenomenal. He's the one name which comes to my mind when I think of a cardiologist author, having authored some seminal books on pain, on pain management and the epidemic of pain in the US. It's gone on. His books have gone on to be translated into multiple languages and being read in different countries, which tells you the caliber of his work. He's also published seminal work in heart failure and chronic diseases in all the top line journals, JAMA, New England Journal, Lancet, what have you. And his new role is quite the honor, actually. He's now a senior advisor for chronic disease management to the Food and Drug Administration Commissioner, Dr. Califf. So if that introduction is not enough, Haider, welcome on the show, and thank you so much for doing this for us.
Thank you, Ankur. It's a real pleasure and honor to be here, and both in my capacity as a guest, but also as a friend.
Yes, no, I think your blooming career is a good topic for discussion for our listenership. Not only cardiologists at large, across the globe, actually, quite frankly, and but also trainees and medical students and residents and fellows and early career faculty. So let me begin by asking you, what led you to a career in medicine, Haider? I don't think I've ever discussed this with you before, but I'm going to use this platform to ask you this question.
I think if there's one thing that has been constant in my life is that I've always been interested in a lot of different things all at the same time, which is, sometimes that's good, but, often it isn't. And that's kind of where I was when I was in high school. Believe it or not, I had applied to 3 colleges. One was a dental school because my mom was a dentist. The other was an engineering school, which is close by. And the third was medical school. And I then had to decide where I was going to go. And the reason I picked medicine was mostly because of the medical school that I went to, which is Aga Khan University Medical College in Karachi. It is, I would say, one of the really special places to receive an education in Pakistan, but also in that part of the world. So really, I must say that, when I went to medical school, there were a lot of people there who had really sort of rich stories and reasons for why they were there. They'd had some experiences in their personal life, or they had some intellectual curiosity. But I went in without really having a very, very clear sense of why I wanted to be a physician. But I'm very glad that I did, and in part I had to sort of create that reason. over time. I had to really sort of find my way, when I was sort of already deep deep and pretty far along this pathway. But I think that's what the beauty of medicine is, that there is no one path, that there's so much that we can do and experience within this profession, that especially for, I think, people who don't have a clear sort of fixed sense of who they want to be or who they are or what they want to do, I think medicine just offers opportunities that few other careers do.
Yes, no, I agree with you. I think, medicine at large, but even within our own subspecialty or, subspecialty within medicine, which is cardiology, there is a breadth of, tasks or pathways you can take, developing a career, which actually leads me to my next question is, when did the bug of writing get to you, Haider?
Well, that bug preceded my going to medical school. Ever since I was young, I gravitated towards books, and I gravitated towards telling stories. Even when I was young, I remember I used to draw comic books for myself, and then I started writing stories. There was this magazine when that many people who are from Pakistan, which is where I'm from, had read when they were kids, and it was called Us Magazine. And so I started writing stories for them. They were all fiction, and just having seeing my name in print and being able to write those stories was really just a phenomenal experience for me. I was, supported by my parents, especially my dad, in that endeavor. And I think that the one thing that I did that I feel like a lot of people don't is that I continued that even after I joined medical school. You've probably seen this yourself, and you're obviously a writer and as well, but you get these kids who join medical school and they have these rich experiences and these amazing talents, but as soon as they join medical school for one reason or another, they don't pursue them in a sort of meaningful way, and that was really sort of the main difference, I think, between what I did and what others didn't, or at least many others didn't, was that I persisted with writing, and I kept writing, and I didn't really have an audience. I would write, stories, pretty much almost exclusively for myself or a couple of other friends who were generous with their time and would read what I'd written. But most of my friends wanted nothing to do with it. Most of the writing that I did in medical school went unpublished, and so it really just stayed in my computer. Or in tattered photocopies sitting in my dorm room. But I did what I could, and I just loved the process. I must say that I was writing mostly fiction, which is very, very different from what I'm writing nowadays, which is mostly nonfiction. But I just kept doing it, and for me, the big difference or the big change came actually pretty late, which was during residency. And so, one of the things that writing was doing was, even though it gave me a lot of joy, and it gave me it allowed me to sort of inhabit this world which is rich and colorful and fantastical. It almost created a schism between what I loved doing, which is writing, and what I was actually doing, which was training as a physician. And part of that was because my writing had nothing to do with medicine. That may have been in part because I just never felt like I understood medicine to the extent that I could actually have something meaningful to say. And it took a long time for me to get to a point where I felt like I was seeing things or was able to describe things in a way that really felt original, that didn't feel tired, that didn't feel like it was stale in any way. but it took a long time for me to get there. And when I did, which was in my second year of residency, when I was at the BI, I finally started to write about, my experiences as a physician in training at the bedside. That really turned, I think, my career, and it brought these two worlds together in a way that really, I think, helped both. It helped me as a physician. It helped me become much more observant. I think it made me a better communicator. It made me more present in the moment. It made me more empathic. And I think it also helped me as a writer, because now I was conveying experiences that I was such a sort of close witness to, that there were people who were interested in being sort of being in that place where I was, and they were interested in that perspective. So, I mean, that's a sort of broad overview of my writing, and we can talk more about others, but that's how it changed. And it was that moment when finally those two worlds came together that I really felt like a whole person, because I did feel like now these two things that I was there's this one thing I was passionate about, this other piece that I was technically getting more adept at. When they came together, it really sort of brought it brought things full circle in a really meaningful way for me.
Yeah, no, it's very introspective, the way you answered the question. And I don't think I've come across fiction work from you, although I'd be very interested, because you write very eloquently. And I think your nonfiction work is the one that you've published, and now I believe 2 books. Is that right, Haider?
Yep. So 3 books. So my first book was Modern Death: How Medicine Changed the End of Life, and that was really that I started writing that in my 3rd year of residency, and it was published when I was, I believe, a second year fellow. And then I wrote a book about heart disease, which I wrote, at the end of my cardiology fellowship. And then most recently, I wrote the book that you mentioned, The Song of Our Scars, The Untold Story of Pain, which was about chronic pain, which I wrote, actually wrote it right when the pandemic started. And so these are the sort of 3 nonfiction books that I've written.
So yes, Haider, I mean, clearly you are a prolific writer. I mean, both in terms of scientific publishing as well as authoring books. And for someone, and I think I've asked this to other physician authors who've been on the podcast as well, prolific writing is one aspect, but to have the discipline, in the middle of a career as a clinician, to then spring up with 3 books. I mean, residency and fellowship is a particularly grueling time in a physician's life. When you don't have control over your schedule. How did you come up with the ergonomics of authoring 2 fantastic books? I mean, both Modern Death and the second one on heart disease. How did you do that amidst residency and fellowship? Let me ask you that question first, and then I'm going to delve into some of the more aspects of writing.
Right. I mean, I think that you have to be. I mean, what I will say is that when anyone thinks about writing a book, and this, even when I thought about writing a book for the first time, it feels like an impossible task. It feels like, and it really just feels outside of the, because all of us write to some extent, right? Whether we're writing HPIs or progress notes or writing, research papers, emails, on social media, etc. So we're all writing, but just the sheer amount of stuff that goes into writing a book just feels almost an unimaginable task. And to me, but you have these moments, and I think everyone, and you have these stories, and you have where it just feels like, and where you have so much to say, and you that it doesn't that if anything, keeping it inside feels more work than actually writing it. But then, as far as the sort of practical aspects of what it takes to write a book as a busy professional, which all of us, most of I'm sure most of our listeners are. First of all, it has to be, you have to really love the process. If you don't like to write, if the process itself is painful, it's hard for me to recommend it to anyone. I mean, some people who are amazing writers actually hate the process of writing, and I don't know how they do it. But for me, that love has to be there. The second thing is just being disciplined and just making sure that, are you going to take out some amount of time every day, whether you're tired, whether you're sleepy, whether you're post-call, to focus on it. And it may not be writing, it may just be reading or research. I mean, most of my books are, I have to say that, 80% of the work is basically research because, as a physician and scientist, it's very hard for me to approach the blank page without feeling like I have confidence about or knowledge about what I'm going to say. And so that type of discipline is extremely important. And the system, and then the third thing, I would say is really, it's like any form of, it's like exercise. Is you can't just, if you're going to run a marathon, you can't just decide to do it one day. You have to, to train for it over a long period of time to get to a point where you can, you are ready and you're prepared to take that journey on. And then, maybe lastly, I think having a supportive environment, and for me, that was, my wife, who, also believed in this and who believed that this was a worthwhile endeavor. So I think those are some of the key ingredients. But what I will say is that it does seem harder than it is, the writing part. In part because the types of things that we do in our lives are there's so many things that are, I would say, in so many ways so much harder than writing a book. I mean, I'm a foreign medical graduate. I remember preparing for step one and feeling like that was the most important day of my life, and that would determine how my life would proceed from that moment. And so the amount of work I put in for that, as I'm sure so many others did, or people who, just the fact of going through residency and fellowship or writing a grant or writing a difficult paper. I mean, we do a lot of really, really difficult things just as part of our routine work. So I don't think that the book is something that is, especially intimidating or should be intimidating, as long as you have the inspiration, as long as you have the love, as long as you have the reason. I think that's really, to me, is the more important thing.
Yeah, no, I couldn't agree with you more. I think you have to have well, first off, I think you said something which resonated with me extremely well, and that was that when it becomes harder for you to keep it in and easier for you to put it on paper, that you have to write, and then obviously that has to then be combined with the discipline of carving out time, a dedicated amount of time, whether it's on a weekly basis or on a daily basis, to put something on paper. I mean, the only way you're going to write a book is if you actually write, right? And then obviously having content expertise requires a lot of preparation and reading. So Haider, this I know this is not, I shouldn't even ask this question, but I think that the fact that it occurred to my mind, I'll probably go ahead and ask this question, is do you have any particular favorite of the three that you've written so far? And if you do, why?
Well, so I would say, well, first of all, it's the two books that I am more proud of are basically My most recent book, which is The Song of Our Scars, which is on chronic pain, or my first book, which is Modern Death. Part of me, and the reason I think that, especially the last book, that was really, to me, was probably my best written book, and part of that, I think, came down to just how I approached the book. This was my third book. I'd already written 2 books, and I really felt that there was something missing, and I needed to, and that I really, I really needed a change in an approach. And one of the things, nowadays is that if anyone wants to learn about chronic pain, or if they want to read a great article on chronic pain, for example, let's just use that as an example, they can go online right now, and chances are they are going to find a really, really great article or a feature or long form essay on chronic pain completely for free, that they can read whenever they want, and that they can take some take home points from. So the real question is, what are you going to write that is going to make people spend money to buy a book that's going to take a long time to read? I mean, we've talked about the time it takes to write a book, but the reader is also investing their time in reading a book that can take a long time. So the question is, what is it that you have to say that is going to make someone go ahead, buy a book and read it, and what is the central driving idea that shapes the entire book that is going to make that happen, especially at a time when there is no shortage of great ideas, great writing, freely accessible to most people who have either a library subscription or have access to the internet. And so I did feel that that I had a different approach to this book. I think what was also interesting about this book was that, at least from a scientific perspective, it was different from anything I'd done before. So if anything, I felt even more compelled to be even more prepared. Than I had been in the past. So in some ways, I do feel that the most recent book is probably the book that I am proudest of as far as the entire package is concerned. But I mean, there's a cliche amongst writers that whenever you ask them, what's your favorite book, it's always the last one. But in this case, I actually feel that, at least to me, that it was probably the hardest book I've had to write. The first book, Modern Death, was different because it had its own set of challenges. So the belief it needed to just write a book and feel that someone's going to be interested enough to publish it. It takes a certain degree of delusion that I can't afford to have anymore. But that had it. So that journey itself was fun as well. And it's one that I think shapes how I think and what I do and who I am to this day.
Yeah, no, fascinating. Haider, let me ask you this question. You wrote about modern death, and, as cardiologists, certainly chronic coronary disease or cardiovascular disorders are, like the top killer in the country for, chronic, amongst chronic illnesses. It sort of is intuitive that you would write about modern death, I think if any specialty, we're at the forefront of modernizing death, with all the innovation and devices and drugs that we come up with, every year. So I think to an outside person like myself who has watched your career blossom, it would feel intuitive that you would write on modern death. How did you decide to write on chronic pain? When did you interface with taking care of patients with chronic pain, or that was something that the pandemic brought about?
Yeah, well, mean, the reason I wrote about chronic pain was actually because and I would say that was probably the most important reason why I wrote the book, was because I actually had lived with chronic pain for a long period of time. And, it all started after I had this really bad back injury when I was in medical school. I was, in medical school, I was just your typical jock, medical student who, spends most of his day in the gym or, playing sports, etc. Extremely careless, feels like they're invincible. And it was, just one random day that, I was lifting weights, and I was actually doing a bench press, and I, basically heard this loud click in my back. My whole body essentially went limp. I was trapped under these weights that I had basically no ability to get off my body. There were folks around the gym who noticed that I was in trouble. They helped lift the weights off. They rolled me to the emergency room, and I got an injection of Toradol, and I was told that this pain is going to go away. And I believed that because that is what I think my experience with pain had been, that, you hurt yourself, pain is pretty bad at the start, and then over time it goes away. But the only difference was that this pain didn't go away, and it didn't go away for years. And it really affected me in a very, very deep way. I could essentially not even function as a medical student. I could not be in the OR. I couldn't stand. I couldn't sit. And I couldn't lean. And I lost a lot of weight. I couldn't exercise. I could barely leave my room. Lost pretty much most of my friends. Just climbing a set of stairs was the most intimidating thing that I could face. I mean, and over time, over time, and with a lot of luck, and with a lot of support, and with a lot of physical therapy, and all, it took a real village. It took me a few years to get better. But even to this day, even when I was in the cath lab, I loved being in the lab. When I would come back from the lab, my heart would be happy, it would be racing, it would be excited, but my back would be saying, hold up. So I had this personal experience of pain, which really, I think, changed how I saw, patients, because, back pain is one of those, I looked completely fine. If you saw me back then, you'd feel like I'm just a normal person. You'd have no idea what was going on inside me. And I think that's a situation that so many of us find ourselves in. And that's one of the reasons I think it's sad, but it's true. But think about how many physicians write after they've fallen sick, right? Because that personal experience, I think, helps them cross over into what it's like to be a patient in a way that the absence doesn't. But then, fast forward, I became a resident, and then my residency was like so many others, was dominated by negotiating opioid prescriptions for patients with chronic pain. And this was, at the time when opioid prescription was at its peak in the United States. We hadn't really coined a term for the opioid epidemic. We didn't even realize what the effects of what we were doing in medicine was having. And then the last thing is that the science of chronic pain was incredibly interesting, but it had very little bearing on how we actually treated it. So if all these things came together, this personal experience of pain, which I think was very essential, because I think most people who have pain, they believe that, only someone who has or lives with pain can understand what it means to be or feel what they feel. And then that experience of being a physician who is always, up against all these challenges around treating chronic pain with tools that we know are extremely bad, i.e. opioids. I think those experiences, I really felt that I was in a unique position to be able to talk about this really common, vexing, but incredibly interesting phenomenon that affects, 1 in 5 people, not just in this country, but also around the world. So when those things kind of came together, I'd had previous ideas about what I wanted to write about, but this one, it just felt like everything was there. So that's really how I came to write about it.
Thank you for taking us through your own personal journey. It's inspiring to learn the genesis and the inspiration behind the book, which I think if you look at just your literary work, across the spectrum of what you've written, from modern death to heart disease to chronic pain, actually forms a great foundation for you to have a title which you have now, which is a senior advisor for chronic disease management to the FDA Commissioner. Tell us more about this, Haider. How did you stumble upon a beautiful title like this?
Well, it was all, like so many things. It was at least partly serendipitous. So, a lot of my writing ended up impacting or affecting my research. When I wrote about end-of-life care, that informed my research, which was really focused on, how can we do better for patients with heart disease at the end of life? And within cardiovascular disease, as I mentioned before, I was always someone who was interested in a lot of different things. So I was interested in palliative care. I was interested in geriatrics. I was interested in health, the economic aspects of medicine, decision making, financial burden, etc. The list was long. And when I would go to, one of my mentors, they would say, what are you doing? You need to focus. You need to sort of narrow things down. And I think that for most people, and I think that is the exact absolute right thing to do, to really develop deep knowledge or really deep expertise in a specific area within medicine, within one's chosen field. And I think for me, that was just something, for some reason, I'm just one of those people, we just can never say no, right? And so I had all these diffuse interests in medicine and primarily around chronic conditions. And then what had happened was that one of my mentors, Dr Rob Califf, who was previously commissioner of the FDA before I knew him, was nominated by President Biden to resume that position at a very challenging time in medicine, where there's a lot of distrust about what we do and who we are. There are a lot of challenges that we face, coming out of a pandemic, and then now with this rising tide of chronic disease. That really was one of the main reasons why Americans did so poorly during the pandemic, was because we have so many chronic conditions that put us at high risk for having poor outcomes. So this position was created by Dr. Califf. There are two positions. One was focused on mental health and substance abuse and behavioral health, and the other was on chronic disease. And this just felt like a great fit. I mean, for anyone out there who's had the chance to work with Dr. Califf in any capacity, I mean, they will tell you that I would have taken this position, even if it were regardless of what the underlying topic was, because just the opportunity to work closely with Dr. Califf, learn from him, see how he leads in his own sort of very unique way would have been enough for me. But I think the fact that it pertained to chronic disease and really allowed me to work at, I would say, a leading public health agency that, it has a mandate across drugs, devices, digital health, AI, nutrition, and tobacco. Was hard to pass on. So that's really kind of, that's why it was interesting to me, because the mandate was very broad, which, in academia, that was something I was struggling with, but here it could potentially actually be a strength because it was so broad, and it could allow someone like myself who has all these various interests to actually use them in a meaningful way that supports the mission of the organization. But then also, I think the opportunity to work with Dr. Califf, but also all the unbelievable, amazing people at the agency, both sort of in the office of the commissioner and leadership, but also in the various centers who have really dedicated their lives to protecting the public's health, who have dedicated their lives to science, and just the ability to learn from them and see how seriously they take their work has been pretty amazing. So I've worked full time at FDA, but I still continued my clinical work at Brigham and Women's Hospital.
Fantastic. I think I resonate with the problem of diffuse interests as well, as you may know. And I think what will that lead to? I don't know yet. I'm certainly of the belief and opinion that the better days are still ahead of me. Haider, final few minutes on the podcast. I do want. I think you've touched briefly on this as to what you do as your in your role, encompassing various disease states, but also digital health and augmented intelligence and nutrition and tobacco. I want two questions here, two-part question. One is, what does an average week or an average day look like in your life at the FDA? And I think this is going to be fascinating for the listenership, because many of them would aspire to look up to a career like yours. And the second part of this question is, it's a focused question, is a question I also asked Dr. Fuster in our Centennial episode, and that is, how is the FDA looking at AI? What are some of the conversations you've had around AI? I know this will probably be an episode in and of itself, but in a nutshell, if you can maybe describe succinctly what those conversations have been, I think that'll be fascinating to hear that from you.
A day in the life of, I think, of someone who works at the FDA, and I'll just say it's a great place to work. Of all the governmental agencies, the FDA is only behind NASA in regards to how highly people rate their quality of life, which is why so many people work here for such a long time. But everyone's experience on a day-to-day basis might be different depending on what they do. My work is I work from home, and I'm still based in Boston for the most part. But my work is really focused around specific problems or sort of areas that I'm focused on that are felt to be areas of need, and then really it's a matter of me going to the experts and saying, how can I help you? What are the gaps you see? And so, essentially working with the staff to sort of look at problems and then seeing, how can I help them achieve their sort of mission within as it pertains to chronic disease. With regards to AI, I will say that the FDA has been, and this is, a lot of this is all public information. So nothing I'm sharing here isn't out there, but clearly I think the agency sees AI as a potentially transformative technology, and both for many different applications to improve patient care, to improve physicians' quality of life, to help potentially with drug discovery, and also potentially with improvements in clinical trials. Our North Star is always, is just having a high quality data to guide decisions around these technologies. But if you see, we FDA has approved hundreds of AI enabled medical devices, and the second most common indication after radiology is actually cardiology. So cardiology, AI. So if you look at AI technologies, cardiology is second, right behind radiology, in how many sort of devices have received FDA approval. And some of the things that FDA has done show just how important they think this space is. So there was a draft guidance, for example, that was published that speaks to one of the challenges that AI presents from a regulatory perspective. Unlike many products. So, for example, if you have a drug that you do a phase 3 trial on and the data looks good and you present to FDA, the drug that patients get versus the drug that was approved is the same. For example, Entresto is no different today than it was when it was presented in front of the FDA or when it was tested in Paradigm. But AI can continue to evolve. Sometimes it gets better, but sometimes its performance can get worse over time. But FDA has, for example, developed their draft guidances after really listening to all the stakeholders about how to incorporate or how to develop prospectively plans for managing those changes without having the manufacturer then having to come back to the agency for every single change that is made. So I would say that I think Dr. Califf is, and others, including Troy Tasbas, Matt Diamond, these are our leaders in digital health. They have been at the forefront of really taking this challenge on and making sure that our processes continue to evolve with the technology. We see a lot of. I think it's fairly clear that this is a potentially revolutionary technology, and we've already started to see applications of it in clinical use. These applications are only going to increase, and if you look at both the volume of approvals, but also in other facets, I think our goal is to keep up and make sure that the products that do make it to market are safe and effective. And that the regulatory pathways are tuned to be up to that challenge.
Yeah, no, fascinating, Haider. It's been great to connect with you after some time, and it's been just fascinating to see your career and your journey, and the multitude of roles that you've undertaken, and the books that you've written. It's just very heartening to see what all you've accomplished. Any closing remarks for Parallax and for the listenership?
Well, I mean, being a cardiologist is still one of the, probably the most fun thing I get to do. If anything, I think in my current role, when I'm on service, it's even more exciting because, I'm not doing it as often as I was, and I can certainly see myself transitioning to a more clinically heavy role in the future. But this is really the beauty of our field. Is that, like you mentioned, there is so many ways that there's so many different ways to be a cardiologist, and there's so many different paths that people can take. Just look at the types of people you've spoken to in the past and will continue to speak to in the future, and also your own career as a structural cardiologist who has all these interests. I just think that there's very few. There are very few things that offer the sort of flexibility and room for innovation that our field has. So that would be my closing remark. Is that despite all of these things, I think when you're at the patient's bedside and you're able to help, that there's just nothing like it.
Excellent. Yeah, this was a great interview. Thanks, Haider. And thanks to everyone for listening and tuning in. Like always, do leave your comments, and if you have any questions, feel free to email them to us. The email address is in the show notes. We'll make certain that all of Haider's books are listed in the show notes section of our podcast. Do review us and do rate us on different social media as well as podcast platforms, including Apple Podcasts, SoundCloud, and Spotify. Once again, thanks for listening, and we'll see you back another Monday.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/parallax. Thanks for listening.